Hey, my name is Dwayne Franklin. I'm a nursing student. I'm going to do a head-to-toe assessment on Rick, my patient Rick. But before I do that, I'm going to practice hygiene and wash my hands. I'm going to raise the bed up to waist level. I'm going to push the side rail down. And then I'm going to ask my patient his name. And then I'm going to ask him why is he here and does he know where he's at and what is the name of the president that we have now. And then he gave me a correct response, so I'm going to move on from there and I'm going to check his head. I'm going to check it for hair distribution. I'm going to check for symmetry. I'm going to check for redness and lesions. I'm going to go to the ears. I'm going to check for symmetry on the ears. I'm going to check for redness, any drainage, and attack to the skin. I'm going to check the eyes. I'm going to check the color of the eyes. I'm going to check the symmetry of the eyes. I'm going to see if they're symmetric. I'm going to check and see if there's any edema. I'm going to go for the nose and see if there's any redness in the nose, see if it's symmetrical. I'm going to check and see if there's any drainage. Then from there I'm going to go to the mouth. I'm going to check the lip, the colors of the lips, make sure that it's good. I'm going to check for the teeth, for gingivitis. I'm going to check for hard palate and soft palate. Check for any redness. And I don't see there's no dentures in there or a breathing mask. So then I'm going to check his thoracic and check it on both down here and make sure that's good. And then I'm going to oscillatate for the anterior and posterior. And then while I'm here, I'm going to also check for the PMI. Then I'm going to lift the patient up. And I'm going to check for accessory muscles too while I'm down there. Okay. After that, I'm going to check for the brachials on both arms. I'm going to check for the tibia, the radial pulse on both arms. Then I'm going to check for the capillary refills on both arms. Then I'm going to get him to move his hands. I'm going to move his hands and then check and see and squeeze my hands. Make sure that's good. Then I'm going to oscillatate the abdominal and make sure for bowel movements. Then I'm going to palpate all four quadrants. And then I'm going to also check their carotid on this side and this side. I'm going to check for the femoral on this side and this side. Then I'm going to check for the popliteal on the other side too. Then I'm going to check the posterior tibia and posterior tibia on this side. Then I'm going to do the dorsalis pedis on this one and on this one. Then I'm going to do the Homan sign. Then I'm going to do it on this side too. Then I'm going to do the flex, and then extension. And then I'm going to check for edema. And then I'm going to also ask him if he's in any kind of pain or anything like that. And then also when I was doing the palpating, I'm going to ask him if he's had any vomiting, any diarrhea, nausea, is he constipated. After that, I'm going to, he doesn't have a catheter and he doesn't have an NG tube, so I'm going to cover him back up. I'm going to lower the bed to the lowest position. I'm going to have it locked. I'm going to bring the the railing back up. I'm going to move the bedside table here, and I'm going to put a call light and make sure you can get it in reach. And then I'm going to wash my hands